Hello and welcome to Dr. Sushant's anatomy tutorial. In this video, I am going to talk about the swelling in the groin region and its differential diagnosis. A patient with a swelling in the groin comes to a doctor. He has these types of swellings. There's a swelling that looks like this, and these. Alright. Therefore, while examining a case of lump in the groin region, a clinician has to recollect the following anatomical structures in the femoral triangle, which may give rise to swelling in the groin. Alright, there are so many structures in the groin region which can undergo enlargement and look like a swelling in the groin region. Now, what are those structures which can enlarge and give rise to swellings in the groin region? So, when you see a patient with these kinds of enlargements, you prepare a list, and then, so that list is called differential diagnosis. Then you do further tests, then narrow down to a particular diagnosis. Alright, so what are the structures that may give rise to swelling in the groin region? So we are going to take a look at those structures. Okay, so first one here is a subcutaneous fatty tissue forming what is called a lipoma. Alright, so there is an enlargement of some subcutaneous fatty tissue giving rise to a lipoma. So that can be a swelling in the groin region. Secondly, it can be a femoral hernia. Okay, or it can be an inguinal hernia. Alright, so this pubic tubercle helps in distinguishing the swelling of femoral hernia from that of the inguinal hernia. How? The femoral hernia is inferolateral to the pubic tubercle, whereas the inguinal hernia is superomedial to the pubic tubercle. Alright, so this is where you have the pubic tubercle. Right, this is the inguinal ligament. We know it is attached to the anterior superior iliac spine laterally, and medially it is attached to the pubic tubercle. So here is the pubic tubercle of the right side. This is the pubic tubercle of the left side. Now here is an enlargement which lies below and lateral to the pubic tubercle, and you should diagnose it as femoral hernia. On the right side, there is a swelling which is located above and medial to the pubic tubercle, and you should diagnose it as inguinal hernia. Now, a third case where the dilatation or the aneurysm of the femoral artery forms a pulsatile swelling. Alright, so there is weakness in the wall of the femoral artery, and the femoral artery, due to the pressure with which the blood flows through it, undergoes enlargement. It balloons out, giving rise to a dilatation or aneurysm. So femoral artery dilatation or its aneurysm. Alright, so this can be a swelling in the groin region, and it is pulsating. So if you find a pulsating swelling in the groin region, it has to be the femoral artery, okay, undergone aneurysm or enlargement. All right, now next one is there is a hematoma. Okay, there is a hematoma due to an injury of the femoral vein, that is due to the venipuncture. During venipuncture, the femoral vein has undergone some kind of injury, giving rise to hematoma. Okay, so this swelling in the groin region can be a hematoma due to injury of the femoral vein during venipuncture. All right, or it can be the enlargement of the great saphenous vein or dilatation of the great saphenous vein at its termination into the femoral vein after it passes through the saphenous opening. Or this enlargement can be the neuroma, okay, of the femoral nerve. So there's an enlargement of the femoral nerve giving rise to neuroma. So this swelling can be a neuroma. Or this enlargement can be pus arising from the tuberculosis of the thoracic vertebrae and as it tracks down along the psoas sheath to present as a swelling known as psoas abscess. So this can be a case of psoas abscess. All right, psoas abscess. Next, this can be due to enlargement of the inguinal lymph nodes. All right, so the inguinal lymph nodes may also enlarge following any inflammatory lesions or malignancies in the areas of their drainage. So this swelling can be enlarged inguinal lymph nodes, all right, or it can be an ectopic testis, right? There is a ectopic testis in the region of the femoral triangle that can present as a lump in the groin. So these are the differential